Hi, this is Jessica DaMassa with WTF Health, and I am here at Health Datapalooza with Bob Kocher and Bryan Roberts, both from Venrock. Nice to have you guys.
Good morning.
Good morning. All right, so tell me a little bit about what you guys are doing from an investment standpoint. What are you guys excited about in your portfolio?
We're really excited about platforms. For a long time, there was a trend towards point solutions and more narrow-focused products to engage you in some aspect of your health.
Okay.
We're more excited now about things that can actually change your health care.
Okay.
And so, two platform companies that we're really excited about are Doctor on Demand, which does video telemedicine, and they can do a whole range of primary care and urgent care. Mm-hmm. And it can be like Grand Rounds that can work on more of the higher acuity type stuff and get you to the right doctor and the right treatment and then make sure it goes well.
Okay, tell me a little bit about this transition then from to platforms, because I feel like I've been hearing that quite a bit at different conferences. So, I mean, why are we moving away from these single one-trick pony type digital health apps and things like that? Why are we moving away?
Yeah, so the point solutions have been a nice way for sort of the innovation in healthcare to sort of start to get seeded. Mm-hmm. But healthcare it's a journey for patients, right? And just helping them with one piece of it actually doesn't get the job done. And so what you're seeing is that those point solutions are not, in fact, gaining broad enough traction and persistent enough traction within their patient populations.
Okay.
And so the transition from point solutions to platforms is really one where somebody says, I'm going to take responsibility for the totality of you as a patient, right? Mm-hmm. And from beginning to end, I'm going to probably innovate in a couple of pieces of that journey, but I'm going to be responsible for the whole journey, right?
Okay.
And so you can imagine in Bob's descriptions for Doctor on Demand, telemedicine, virtual medical visits are going to become the new front door to healthcare, mm-hmm. right? You have a problem, you don't know what you're doing. You're like, right. Okay, wait. I got to figure out where to go. What's the easiest way to do that, right?
Press the button on your phone.
It's press the button on your phone, right? It's not call somebody, call back 3 times, have an appointment in 3 days,
yeah.
Have to get in the car, the blah, 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 right? So, but you can imagine telemedicine also then becoming an adjunct to all of your care. So it becomes a platform if you have a chronic disease, mm-hmm. right? Today, if you have heart disease, you go see the heart doctor a whole bunch of times a year. You can imagine 80% of those visits being done virtually.
Right.
Right?
Mm-hmm.
And that is going to both make it much more convenient for you as a patient, which, let's be clear, most patients don't do all of their care. Right? Most patients don't take all their drugs. Most patients don't go to all their visits. Frankly, it's a pain in the butt to be sick, right?
Yeah.
So the easier you can make it, in fact, you're going to get more engagement mm-hmm. from patients over time, which is going to lead to better care just by the fact that you've made it more convenient. Leave aside all the good stuff you actually do. And so that's where the platforms come in.
Okay.
The other point is that patients have more than one disease.
Yeah.
And if you're a patient, kind of up to now, you've had 8 apps in your phone, one for each disease, one for each of your doctors.
And they don't talk to each other.
And they don't talk to, and they're all pestering you. And they aren't all equally important. So we treat everything like it's cancer, and they're not all cancer. And so if you have a platform, it can help prioritize with the patient what to take care of now and then what we can watchfully wait for. And it puts it all in one place.
Okay.
And so that has the potential to be a lot more effective than the sort of let's engage you in 8 different ways, because we're competing against Netflix and Candy Crush on your phone to engage you. And so of course you're not going to go click the pill tracker.
No. So I have a question. So we have a lot of startups that watch us. And so what is your advice to those startups that have a point solution? Now what do they do?
So my biggest piece of advice is spend a lot of time thinking about what problem you actually want to solve.
Okay.
Right? I think lots of companies get started because someone found something and then they look for something to apply it to, mm-hmm. rather than before you actually start on a 3 or 5 or 10-year journey with all your time and a bunch of money, figuring out, okay, what do I have and what do I want to do? Are those a match? Is there a big enough problem? Is it addressable? I think spending more time really trying to convince yourself not to do something, right? And figuring out what the problem is mm-hmm. before you set out on the journey is the important part of the equation.
The other key point is healthcare costs too much.
Yeah.
$3.4 trillion, $18,000 for a family. You're going to charge somebody for your thing. you better figure out how you're going to make that person better off by
Right.
creating net savings or net value for them right away. Because nobody has enough profits actually to wait 3 to 5 years for that thing to pay back. It has to pay back right away. And I see a lot of companies that are saying, yeah, it's going to prevent something in the future.
Yeah.
And people can't afford to wait.
No. And so talk to me a little bit about what you guys were saying. You guys finished a panel here at Health Datapalooza and you were talking a lot about ROI. And I thought you guys had some great points. I was following along on Twitter. So tell me a little bit about, like, I guess what startups need to know, or what really anybody in the health industry needs to understand about investing in new companies and the expectations for ROI.
Sure. So the two primary takeaways are, one, nobody in the healthcare system makes any real money, right? So hospitals, insurance companies, doctors, they all run about break even for whatever their either institutional or personal income statement is. So as Bob notes, you have to have a tangible ROI, right? Has to save somebody money, put more money in their pocket. Number two, because there's so much turnover in the relationships in healthcare, right? So insurance companies only keep a member for on average 18, 24 months. There's not even the sense of a long-term customer relationship for providers, right? People move doctors, they move hospitals. So you've got to actually provide that cost savings within a 1 to 2 year period, right? Like it's got to be that tangible and that short term. Otherwise, like with preventative care in the US, right? There's all sorts of things that one could invest in for people in their 30s and 40s that would make them healthier in their 50s and 60s. The problem is that the people who are paying for that care in their 30s and 40s are different than the people who are reaping the benefits of improved health in their 50s and 60s.
That's right.
And so they're not going to invest in it. So you actually have to have a closed loop of the paying for whatever the service is and the reaping the reward of it within a couple of year time period.
I love that because I think things tend to like scale out in healthcare. Like it's just an ever expanding timeline of things. I'm sorry, go ahead.
The other key point is you need to figure out where the ROI comes from, and they can't be the people paying for it. So if you're going to save money by not using the hospital so much, you can't sell it to a hospital. You can just sell it to a doctor or a primary care doctor.
Like this is great.
And a lot of companies sort of have this unnatural act of like, well, this will reduce readmissions. Of course, hospitals should want it. But if your hospital's not full, you're not totally psyched about buying that thing.
Right.
Now, maybe an insurance company would buy that, or a primary care doctor might buy it if they have a right risk arrangement. But a lot of healthcare companies haven't figured out like who your daddy is, and you need to know where the money comes from that you're going to give back to somebody, and it needs to also be in a way that person that you're taking the money from can't stop you. You can't say, and I need all your data, or I need a connection to your Epic system to do it. Yeah, because they'll be like, well, heck no, it's bad for me. And you have to think through that. I always ask entrepreneurs, well, where does the savings come from exactly? And so who's going to be upset about this? And you have to make sure that they can't stop it.
No, I think that's an excellent question that they should be asking themselves. Last question for you guys. So this show is WTF Health, which stands for What's the Future? Health?
Okay.
Yeah. Because we're kind of in a it's a WTF moment a lot of the time here in healthcare. And so really, it's like things have to get better. So what are you guys looking forward to? I mean, you obviously get presented with a lot of different new exciting ideas, different companies that are coming up. So what has you excited? What's the future? What are you guys looking at?
Yeah. So the thing that I'm excited about is I think we are on the cusp of actually coming into reality, both the fact that there is data and data availability, and there are incentive changes for people to actually behave differently.
Okay, so we're done talking about it. It's actually going to happen.
I think it's not going to be pervasive across the ecosystem, but in pockets, I think there are people with real incentives to improve care and lower costs who now have the information to do so, right? So I'll give you an example. The primary care docs are now responsible for more of the care, right?
Yep.
In ACOs, they're responsible for the whole downstream care, and they now have the information to understand which of the cardiologists that they refer patients to run too many tests, costs a lot, and so they can in fact do referrals on a data-based, data-centric manner rather than, this cardiologist I played golf with on the weekends, or I went to med school with, or whatever the set of rationales, or my patients came back and said that woman was nice.
Right.
Right? But they actually now have a sense for outcomes from those referrals, costs of those referrals, and that sort of stuff. And that intersection of data and incentive, I think we're actually coming to.
Very good. Very exciting.
I'm excited about the fact that we're seeing a lot more interest in businesses that take care of our most frail, sickest, and vulnerable patients,
Okay.
and have business models that allow them to do a great job. And that averts a bunch of complications, a bunch of hospitalizations, and it gets right at the heart of the doctor-patient, making that relationship more effective and better. And then we finally have the incentive alignment and information that allows people to do what we've always wanted to do.
Is there any company in particular that you're thinking of when you're saying that?
I think very highly of like Landmark and how they did home-based primary
Yeah.
care visits. There's a company that called Allidaid that does this with ACO doctors who now
Okay.
see their patients every 2 weeks when they're sick and see them on Saturdays and Sundays. And that's really exciting to me.
Very cool. Well, thank you guys so much for joining
Thank you.
me. It was a pleasure to speak with you. Thank you again. I'm Jessica DaMassa with WTF Health here at Health Datapalooza. Thanks so much.